Okay, it's going. All right. Hi.
Hi.
How are you?
Doing well. How are you?
Good, thank you. It's nice to meet you. My name's Sarah.
Nice to meet you. My name's Adrian.
Hi. All right. Well, welcome to the clinic.
Awesome.
Excited to have you here for an interview. So let's get started. So why don't you just tell me a little bit about yourself? Let's get us started here.
Okay. Well, so I just graduated from Davenport University from
Okay.
their OT program.
Awesome.
Woo.
Yeah.
Before that, I did my undergrad at Purdue. My major was behavioral neuroscience, so
Okay.
I've had a big foot in the behavior field
Mhm.
for a while.
Okay.
Other than that, I have a twin brother. I come from a really big family. Family's a really big thing for me,
Wonderful.
and I love to learn.
Awesome. All right. Well, how do you think your your undergrad degree at Purdue, how that helped you at Davenport? Do you feel like it set you ahead at all? Like that you really were prepared for the program?
Yeah, I felt very prepared. Purdue has a pretty strict curriculum,
Okay.
especially with grades and everything. So I
Mhm.
was very prepared for getting into all the readings and all the
Mhm.
work and working through with others. Like
Mhm.
they instill a lot of really great qualities in their students.
Awesome. Okay. Did you do like any kind of shadowing experience before going to Davenport in OT, just to get an idea of what the profession was about?
Yeah, the year before that I applied to OT school, I
Okay.
actually shadowed in a couple different settings.
Okay.
I went to skilled nursing for a couple weeks. During the summers prior to OT school, I worked in an outpatient therapy clinic, and I would do half the week with pediatric OTs and half the week with adult OTs. So I
Okay.
got to see a big portion of what they do in
Awesome.
outpatient.
Okay.
So that was really cool.
Yeah.
I did some other things that were not so much related, but they still helped me with like going for OT now,
Yeah.
because I did research in neuroscience while I was at
Okay.
Purdue, and that was like
Okay.
a really cool experience for me.
Awesome. Well, it sounds like you kind of got a good idea of the profession before going into school.
Yeah, absolutely.
So how about tell me a little bit about your fieldwork experience at Davenport?
So far, I've had a lot of great experiences. We've had about 4 different opportunities to go out in the field and work with other people, and so I've done pediatric school OT. I've done home health. I worked in a dementia unit, which was really cool. And I just got to work with Parkinson's patients recently.
Awesome.
So it was very
Very cool.
interesting.
What was one of the biggest challenges that you faced in your fieldwork experience?
I definitely felt that it was the hardest thing when I first was starting out in my fieldwork experiences was like not knowing how to act,
Yep.
not knowing just what is expected as much, because you're new, you're getting your feet wet, you're just not sure what to do. Like sometimes you don't know how to talk to patients.
Yep.
So I think one of the most difficult is just getting used to it,
Yeah.
getting accustomed to what it's going to be like.
Yeah. Okay. Let's see. What 5 words would you use to describe yourself?
I'm flexible, enthusiastic, sociable, dedicated, and cooperative.
Awesome. Those are some great qualities we'd like to have in the clinic. Let's see. Could you give me an example of a conflict you've had at any kind of previous work experiences and how you resolved it?
Well, I was a preschool teacher
prior
to the OT life, and I used to have this parent, and this parent didn't want his child sleeping during nap time, and nap time was like a 2-hour portion of their day. And so it became kind of a conflict because he like demanded that the school keep him awake during nap time while the rest of the kids slept.
Okay.
And like kids that age are like, oh, why does he not get to sleep, and then I have to go to bed? And so it caused a kind of like an uproar in our preschool class, and there wasn't much that I could do because it wasn't my place as the preschool teacher to talk to him. So I actually went and told my supervisor what was happening, and she helped me out a lot. Like we talked through what we could do. We talked through with the parent about maybe different options, because at one point he wanted to take his child out of the class during nap time and put him in another, which then you're running into all these different laws, because you have to have like certain teachers to a number of kids, and it's very complicated. So I had to bring in my supervisor.
Yeah. Okay. Well, that was very smart of you to look to your supervisor to help you resolve the problem. So how do you handle stressful situations?
I would say that stressful situations, depending on what it is, I would handle it a little differently. If it was something in the clinic where I felt that it was really stressing me out, I would probably go to someone else for a perspective on it, or like go to my supervisor to see what they think. Just because maybe I'm not seeing something, or maybe there's something I can do differently that will actually make me less stressed.
Yeah, good idea. All right. What do you believe is the most important part of being a clinician?
I believe that the most important part is keeping a client-centered like scope of practice.
Yep.
I think that keeping our mindset on what's best for the patient is the most important, because they're here for us to help them. They are trying to get back to something in their life that they've lost, and they just need guidance and support, and sometimes they don't have that at home.
Yeah.
So I definitely think that keeping a client-centered idea through your own therapy sessions is definitely the most important.
Well, that's awesome to hear. We definitely here at the clinic, we have obviously just that client-centered focus. It's all about what OT is all about, about the client and helping them.
Yeah, definitely.
So that's wonderful. Where would you say that you see yourself in 5 years?
In 5 years, I see myself definitely settling down with a family, but hopefully going back for my PhD.
Okay, awesome.
I have a passion for learning, and I could just see myself going back and getting like specialties or like a higher degree, just so I can learn more.
Yeah, definitely. Well, we love to hear that, you're open to more education and learning more. It's never too late to learn more. All right, well, I think that's all the questions that I have for you. Do you have any for me?
Yeah, I was just wondering, so what does like a typical day look like in your clinic?
Yeah, so we do, we start ADLs, we do everything from the mornings, so we start ADLs in the mornings, so it can be pretty early, starting around 6, 7 a.m., depending on kind of what shift you're starting at. And after that, it can go depending on how long your shift is and what your hours, your schedule looks like. It could go till about 5 or 6, and then you need to allow time for documentation.
Right.
But when we first start you out here, we do like a mentoring program. So we pair you up with an experienced OT. So we want to make sure that your first years, coming right out of school, it can be scary, and just getting used to the profession. So we pair you up with an OT just to provide that mentoring. Yeah.
Awesome. I was wondering about that, because some places I've looked at don't have that mentor relationship.
Yeah, and we're all about helping you, learn just the best way that you can. We have found that it's really helpful to pair a new student or a new graduate with somebody who's experienced in the profession. So.
Awesome. So is there a lot of OTs, or is this more like an individualized clinic?
It's a little bit, I'd say we're a bit on the larger side. We have total OTs employed here we have 25 total.
Okay.
So it's a little bit larger.
Awesome.
So
Big family.
Yeah, very much, yeah.
I think that's all I have for you right now.
Well, awesome. Well, we should be in contact with you soon.
Awesome. Thank you.
All right, nice to meet you.
Nice to meet you too.
Thanks.